first thing is for one to have the interest of one's patient at heart. For me, the driving motivation is my responsibility before God to care for people.
We've gotten the requisite knowledge and skill, and we hope to give the best to our patients and to, make the world a better place.
I'm glad to add my quota in developing this sub-region, making sure our people at least have quality healthcare.
Friendly and welcoming city of Accra, you are all heartily welcome, Akwaba to Accra and to Ghana. The 46th AGSM comes after a very successful 45th virtual AGSM in Banjul, the Gambia, last year. From all the preparatory activities towards the conference, it is quite evident the enormous effort and sacrifices that have gone on to make this a success. And to all you dedicated fellows and members of the local organizing committee, we say Ayiko. It is indeed gratifying to see so many of you physically since the COVID-19 pandemic hit the sub-region, and we are indeed thankful for your continued support to the college. The theme for our 46th AGSM is relevant and most appropriate considering the times. Health and well-being amidst a prolonged pandemic, implications for physicians and patients. We are at this conference going to discuss and deliberate on patients' lived experiences during the pandemic, some of the implications of the pandemic across the various sub-disciplines within the physician college, some of the social, health, and economic challenges that the pandemic has imposed on the sub-region, and also, more importantly, in these times, the role of telehealth. COVID-19, as we know, was declared a pandemic in March 2020 by the WHO, and it has left millions of sick people and thousands of dead persons in its wake, and the West African sub-region was not spared the effect of this. Governments across West Africa took immediate and context-specific pragmatic steps, relying on the strength of their healthcare systems to combat the pandemic, much to the admiration of many and also to the indignation of many who wished us woe. Because, to the view of many, the sub-region has less robust health system that has limited capacity and resilience to deal with such emergencies, that our healthcare system are grossly underfunded and would be constrained in managing cases of COVID-19. Because we also have inequities in human personnel and infrastructure, and that urbanization is disorganized. We have a huge density of population clustered in areas with high mobilities. These were all risks to the spread of the COVID. However, Ghana, like many other West African countries, took immediate steps and effort to combat this by limiting and stopping the importation of cases, detecting and containing cases, caring for the sick, improving domestic capacity and deepening self-reliance, as well as social and economic responses to protect the most vulnerable of the society. Though we are still living with COVID, the health system has shown evidence of resilience in the face of the COVID pandemic, and that essential services continue to be provided. There certainly were disruptions in the provision of specialized care and other maintenance and supportive system of our health systems within the sub-African region, West African sub-region. Even as the health system tries to recover from the challenges imposed by COVID, new threats of epidemic and public health emergencies continue to beset us. In many of the countries in the sub-region, our gallant fellows and members of the college work tirelessly and under enormous and risky work environment to ensure essential services were provided and saved the life of many. And indeed, many lost their lives in the line of duty. In Ghana, much like the other countries in the region, when the president instructed that all others should stay at home and not to go out, on the other hand, the president told us directly as health workers that we should go out to the battlefield and to fight and make the country proud. This is exactly what the colleague did to make our individual countries proud. As I said, some health workers, including physicians, lost their lives. May their cherished memories urge us on to work to strengthen the health systems of all member countries of the college. We, however, would wish, as our honorable minister is here, that managers of our health and governance system recognize this and extend some appreciable appreciation, I would say that, to our physicians and to support the strengthening of our health systems. We are still battling some emergencies: monkeypox, Marburg disease, COVID-19, and the rising scourge of non-communicable diseases. We will urge that all preventive and health-promoting measures that have served us so well should be strengthened and continued in our individual countries. Intensive public awareness and education, strengthening disease surveillance systems and border control systems, capacity building and improved clinical skills in infectious disease management, and building the skill of the health workforce should be a primary concern to many ministries of health. We also encourage prompt use of data for decisive decision-making. The college and the Ghana chapter continue to train the specialists with requisite skills to deal with the health problems of the citizenry. Unfortunately, many of the hitherto government support to the West African College, especially in Ghana, and I believe many other West African countries, have not been forthcoming. The Ghana chapter of the West African College has no office of its own, and we continue to reside in a 2-office space within the College of Health Sciences building in Kolebu. Government and national support to raise a functional office space for its activity in coordinating and training of specialist physicians through a harmonized West African training curriculum is essential. I would say we would like our government to see the West African College as a tool that exists to facilitate sub-regional cohesion and integration at the level of very highly educated and skilled portion of our individual country population. If you get these people working together, it itself deals with the security threats that we face in West Africa, and it is worth investing and strengthening in the West African College towards achieving this for the sub-region. If we did that, thank you. If we did that, member countries have the potential to garner educational, health, and socio-political dividend worth the investment that government make. Towards achievement of universal health coverage, there will be the need for increased local investment in health sector, which will be required for a sustainable health financing system that will provide a safety net for the most vulnerable in the society. In conclusion, the resilience of health systems in the sub-region is being severely tested. Yet, essential health care services must be provided with adequate protection for the citizenry. The West African College of Physicians, as a sub-regional college and as physicians, will continue to show leadership within the health system, and yet we will demand of our health and government duty bearers within the health system the need for increased commitment and prudence in decision-making towards the future of our individual nations and the sub-region. I wish us all well and thank you for the anticipated participation actively in the 46th AGSM in Accra. Enjoy our peaceful and beautiful university campus and the city of Accra and the warm and friendly people of Ghana. We will, however, encourage you to stay safe whilst you are with us. To our graduates, we say congratulations. God bless our homeland, Ghana. God bless the West African College, Akwaaba, to all of you. Thank you.
Pour nos collègues francophones, soyez les bienvenus. Je voudrais parler entièrement en français aujourd'hui, mais ce n'est pas possible. Je suis désolé. To my Anglophone colleagues, don't worry if you didn't understand what I just said. I'm not sure the Francophone understood either. This is my welcome goodbye occasion for me, and this is due to COVID. It is the first time I'm addressing the college in person since I took office almost 2 years ago, and it will be the last time. It has been difficult 2 years for the college as it was for our continent. The COVID pandemic and more latterly the war in Ukraine have thrown the continent and by extension its microcosms like our organization into financial disarray. Your Excellency captured this scenario brilliantly in your recent delivery at the United Nations, and we take inspiration from your preferred solution to sit up and strive towards self-sufficiency, value addition to our products, and economic independence. The West African College of Physicians, in its own small way, is pursuing that path. Great strides have been made to complete our headquarter building in Abuja that will significantly increase our financial standing. We now see the finishing tape ahead, and we hope to break the tape before the end of 2023. For this, we thank our fellows and members who have made sacrifices to see this through, and our Secretary General and College Treasurer who have managed this project admirably. Like politicians, I came to office with a manifesto promising to achieve so many things. Unlike politicians, I will not be standing again. So there is no point beating me with a stick. Notwithstanding, I will outline some of our achievements over the past 2 years. I already mentioned the headquarter building in Abuja, or more precisely, the 6-story accommodation block, which we had hoped to complete during this administration. Apart from COVID, there was also a bureaucratic tussle with the authorities, which saw work suspended for several months. Fortunately, this has been resolved, and we still hope for a completion next year. We also resuscitated the college newsletter, which had not been published for over a decade, and now use it as a major channel for disseminating information to our fellows and members. With the college now boasting 13 out of the 15 ECOWAS states, we feel it was time to review the college constitution to bring it in line with contemporary realities. A review committee under the chair of Dr. Femi Ogumbiyi worked tirelessly over the past 2 years and now has a draft document that will be passed through the relevant committees of college and ultimately the annual general meeting. The college is indebted to Dr. Ogumbiyi and his committee for a work well done. For the first time in 46 years, the college now has a database of all its fellows and members from its inception to the present. Every fellow and member now has a unique identification number that reveals his or her faculty and the year they joined the college. The database also discloses country of origin, telephone numbers, and email addresses. Fellows will soon be advised how to access the database and to provide individual missing data such as telephone numbers and email addresses. For this gargantuan task, I thank our Assistant Secretary General, Dr. Prudence Wachinu, and immediate past Secretary General, Dr. Clemens Ezechukwu, for leading the process. The college secretariat has been transformed, and the working environment is cordial and productive. The addition of IT specialists, a human resource officer, and an internal auditor has increased its efficiency. Annual appraisal of staff is now done for the first time, and achievable targets set for every staff member. The college has now started computer-based testing for its multiple choice exams at both primary and membership levels. This is now done in 3 centers in Nigeria and 1 in Ghana. It is hoped that Sierra Leone, Liberia, and the Gambia will establish centers in the coming year. It is with some regret, however, that much progress has not been made in harnessing the formidable potential of our colleagues in the diaspora by bringing them in as fellows of the college. The college stands to gain a lot from their experience abroad, as well as the resources they control that could be unleashed on our college. The Constitution Review has attempted to remove some of the barriers to their fellowship, such as the condition that fellows should have worked in the sub-region for 3 years, but more needs to be done to encourage their fellowship. The college will continue to find solutions to dwindling number of candidates taking our examinations, and will have to work out a synergistic existence with local colleges. The college also calls on government to address the alarming attrition rate of our qualified specialists to so-called greener pastures. By providing water of encouragement and suitable pecuniary fertilizers, our pastures can be even greener. In conclusion, our college has been blessed with many transformative Secretary Generals in the past. Our present Secretary General, Dr. Albert Akpalu, and his predecessor, Dr. Clement Ezechukwu, are worthy of special mention. They have left an indelible mark on the college for infrastructural, academic, and administrative developments, for which we are eternally grateful. As the Ghanaians will say, Ayeko, or maybe they won't say it like that, well done. I also thank our college treasurer for her skillful control of college finance during these turbulent times. Her charming demeanor belies her steely resolve, and college appreciates her sacrifices over the past 4 years. Thanks also to the rest of EXCO, college committees, college secretariat, and all college fellows and members for their unflinching support during my tenure. Finally, I thank you all for your attention. Thank you.
President, Vice President, President-elect, and members of the West African College of Physicians, members of the Diplomatic Corps, fellow West Africans, ladies and gentlemen, I'm happy to be here this morning to participate in the annual general meeting of the West African College of Physicians, the 46th such, which is being held in our vibrant capital of Accra. To those of you coming from beyond our shores, I say Akwaba, a word of welcome to you. I'm confident that you will discover quickly that you're amongst a people who pride themselves justifiably on their sense of hospitality. This event affords me the opportunity, firstly, to applaud you in the medical fraternity for the immense support you have offered the West African region in the pre- and post-COVID years, and of course, in the COVID era itself. All over the world, physicians are working on the front lines of healthcare delivery systems and are providing essential services in our battle to help minimize the impact of the virus and continue to provide quality health care for all our peoples. I'm aware of the immense contribution of the West African College of Physicians to the training of medical specialties and subspecialties. As the foremost postgraduate training body established in 1976, the various faculties have in a concerted manner trained doctors in the fields of community health, family medicine, laboratory medicine, internal medicine, pediatrics, and psychiatry. These specialties of medical practice, together with their surgical counterparts, have offered and will continue to offer healthcare delivery primary to the citizens of the various states in the West African region and the world at large. Ladies and gentlemen, the world is still striving to unravel the true effects of the COVID-19 pandemic. No one needs to be told about what it has done to the global economy, as every country on earth is reeling from its ravages. Research is still ongoing to find answers to the long-term effects of the virus on the human body. Mention is made of long COVID syndrome and other complications I am not qualified to recount, especially to experts in the field. However, I dare say that the COVID-19 pandemic also brought in its wake acute shortage of professionals, especially healthcare providers worldwide. And that is why the theme of this 46th Annual General and Scientific Conference, Health and Well-Being Amidst a Prolonged Pandemic, Implications for Physicians and Patients, is so apt in my estimation. The time has come for us to begin the discussion on consolidating the lessons laid bare by COVID-19. A problem half diagnosed is half solved, as the adage goes. The pandemic exposed countries in the world, irrespective of status of development, on the need to pay attention to seemingly little steps which are easily taken for granted. For the general populace, the need to observe basic hygienic practices, such as hand hygiene, cough etiquette, and quarantine and isolation, have been reinforced as protective roles in safeguarding the health of all. The rush for personal protective equipment, PPEs, spurred countries to look inward to produce their own PPEs, and Ghana was no exception. Under the presidential special initiatives, face masks and other protective gears were produced locally in the heat of the pandemic. The need to improve laboratory support was made more obvious with the initial limited capacity to testing when the pandemic broke out. Rising to the occasion were the many laboratories, private and public, offering testing today. Lack of dedicated facilities to isolate and treat such highly infectious diseases was made clearer, informing the decision to dedicate certain parts of hospitals as proper isolation units, as well as the construction of the Ghana Infectious Disease Center, dedicated solely to the treatment of infectious diseases. We cannot overlook the blatant need for infrastructural development occasioned by the COVID-19 pandemic. First was the need to strengthen referral systems and to facilitate movement of patients to and from the treatment and isolation centers. It helped that prior to the outbreak of the pandemic, the ambulance fleet of the National Ambulance Service had been augmented with 300 brand new ambulances on the principle of one constituency, one ambulance. In the medium to long term, government's commitment to improving our healthcare delivery system is evident in the Agenda 111 initiative. This project will provide 101 standard 100-bed district hospitals with accommodation for doctors and nurses in districts without district hospitals. 6 new regional hospitals for each of the 6 new regions. Rehabilitate the Afia Nkwanta Hospital in the Western region. 1 new regional hospital for the Western region. And 3 psychiatric hospitals for each of the 3 zones of the country, i.e. the North, Middle, and Coastal. And the entire package at an estimated cost of $1.765 billion United States dollars. Such a development is to help make Ghana a center of medical excellence and a preferred destination for medical tourism in West Africa. It is my determination that the entire project will be completed before I leave office on 7th January 2025 and help bring quality health care near to the people in order to attain universal health coverage. Ladies and gentlemen, the most obvious awakening from the pandemic is the need for Africa to command her price of place in vaccine production. I reiterate my government's commitment to seeing to the success of the Pan-African Initiative for domestic vaccine manufacturing in Ghana. I set up a vaccine manufacturing committee that has come out with a roadmap for domestic vaccine manufacturing in the country. We're working closely with the private sector and fellow African partners to become a vaccine manufacturing hub in Africa for Africans. Our goal is to produce domestically vaccines by the first quarter of 2024. The prolonged pandemic has implication on the training of physicians, as I alluded to earlier in my address, and I believe you're well positioned to dissect and fashion the best way forward. One thing staring us all in the face is the renewed mass exodus of doctors and other healthcare providers to more endowed countries. This worrying trend is not limited only to Ghana, but also to the entire region. Doctors produced by the college remain the toast of most advanced countries, and this attests to the quality of your postgraduate doctors. Of course, I cannot ask you to lower your standard, but is it possible to train more and possibly expand your subspecialty training to cover more areas, such as intensive care doctors? In addition to this obvious enticement of doctors to see greener pastures is the frustration young doctors endure in their quest to specialize in countries within the region. Even though my government restored and made funding available for postgraduate training, the centralized nature of the training requires doctors to move from the districts and regions to the few teaching hospitals. Such doctors have to struggle with accommodation, separation from their families, and in some instances, relocation of the whole family. This has been a huge disservice, ridding the districts and regions of trained doctors and specialists and worsening the already huge disparity in the rural-urban distribution of doctors. It is my plea, as you deliberate on these implications, that you fashion out ways to decentralize training of medical doctors, not only at the undergraduate level, but also at postgraduate. Let us take advantage of the numerous available platforms for electronic learning to provide the theoretical basis of the training, reinforced by the scheduled visits of the trainers to the regions and districts. This arrangement allows for service to be delivered to trainee doctors in their facilities, minimize needless referrals, and allow patients to receive best of specialist care closer to home. The success of this decentralization rests on the willingness of your college to accredit more facilities outside the conventional teaching hospitals for such training. The pandemic has challenged us to take a critical look at some of the routines we have established as norms. Let us apply the lessons learned to decentralize postgraduate education. So accordingly, I have the great honor to declare the annual general meeting of the West African College of Physicians duly opened.
I have the privilege to read a citation on the conferral of the Honorary Fellowship of the West African College of Physicians to His Excellency President Nana Addo Dankwa Akufo-Addo, President, Republic of Ghana. By dint of hard work, dedication, and perseverance, you were elected the President of Ghana after a peaceful electoral process in 2016 and re-elected in 2020, attesting to the sterling manner you steered the affairs of the nation. Upon your ascendancy to the presidency, you worked hard to pass the Right to Information Bill, which engenders transparency in the public service and strengthens the rule of law. You have also emphasized the importance of education as a necessary investment in the future workforce, necessitating the rollout of the free senior high school policy since 2017. No wonder you restored and took over the funding of postgraduate medical education upon assuming power. Your exemplary leadership came to the fore again with your handling of the COVID-19 pandemic. You famously said, "We know how to bring the economy back to life, but we do not know is how to bring people back to life." Epitomize the seriousness with which you tackle the COVID-19 pandemic. The timely lockdown and lifting of restrictions, procurement and distribution of PPEs, novel method of sampling testing as you've attested to, timely rollout of vaccine, and construction of the first infectious disease center, among others, helped to safeguard and protect the lives during the pandemic. Fellow Ghanaians, this too shall pass. Your quest to construct 111 hospitals lent further credence to your determination to remove one of the delays in seeking health care by improving access to the infrastructure in the health sector. As the West African College of Physicians dissects the effect of the pandemic on the theme Health and Well-Being Amidst a Prolonged Pandemic, Implications for Physicians and Patients, we recognize you as a beacon of hope, not only for Ghanaians, but the whole of Africa with your handling of the pandemic. I, therefore, on behalf of the fellows and members, present to the college president, Dr. Ratcliffe Damilisque, His Excellency Nana Addo Dankwa Akufo-Addo, President of the Republic of Ghana, for the conferral and well-earned conferral of Honorary Fellowship of the West African College of Physicians today, the 31st day of October 2022 in Accra, Ghana. His Excellency, could you do us the honors of awarding Dr. Ifeoma Egbuenu the gold medal of the college? West African Postgraduate Medical College. Dr. Dushote, you are highly appreciated by the college. Mr. President, please help us honor his Dr. Kaide Dushote with the gold medal award.
I hereby promise faithfully to defend the reputation, honor, and dignity of the college.
We are here this 3 days for our theme, the COVID pandemic, health implications and implications for the future. We also awarded the President of Ghana, Dr. Nana Addo Dankwa Akufo-Addo, with the honorary fellowship in his recognition of his work he's done for COVID. We are here, 1,500 participants from all over West Africa, to deliberate on issues of the COVID pandemic and issues about the college. So we are here, we hope to have good deliberations and send the results back to our various respective countries. This is a physician of specialists of community medicine, internal medicine, family medicine, pediatrics, psychiatry. So these are, and laboratory scientists. These are top professionals in the echelons of their career who are pushing postgraduate education training across the sub-region.
About 8 years ago now, that's I think April 2014 to be precise, we've written lots and lots of exams, primaries in the college, and then after that we write membership exams, which I wrote in 2017, and then after that we go for part 2 with a fellowship exam. I actually did my fellowship exam in October 2021, and yeah, we're just getting inducted today. So it's been 8 years of growing work, lots of sleepless nights, lots of training, and here we are today, great celebration. It's good to be here actually.
It's a very exhilarating experience. I'm so excited, to be inducted today. It's reward for years of, labor, studies, hard work, and God has decided to, pay me back for all of those sacrifices, and I'm so happy, to be a fellow, and I thank God most sincerely, and to my family, my trainers, my family, and all those that, were supportive to see me, pull through this program. I'm so happy.
I'm a senior registrar at the University of Abia Teaching Hospital. I had my residency training and currently also there at Obafemi Awolowo University Teaching Hospital in Ile-Ife in Nigeria. Well, the journey so far has been quite challenging. I started my residency properly in 2018 and the award I received was for being the best membership candidate in the exams I took last year. I would say that the path leading up to this has been a bit challenging, not very straightforward. Practicing medicine in a setting like ours where you have a very large gap between the number of doctors available to patients that one should attend to, way beyond what WHO recommends. You find that you have to do activities, you have to do things that are beyond what you normally do if things were otherwise. So it's been God's grace to have helped me to keep the ethic of hard work that was necessary to be able to come up to this level, to pass the exams first and then to emerge the best. So the award is a very welcome development, but I think the motivation should be good doctors, who are really helping people, because we deal with lives.
I'm a new fellow inducted today into the West African College of Physicians, and also an award winner as the best in my subspecialty, gastroenterology. Indeed, I'm full of joy. I'm overwhelmed by this privilege that was shown to me. West African College of Physicians is a leading and a noble college in the whole of West Africa. And as a new fellow, I'm also grateful. I'm happy to be inducted today. There's so much work to do in our sub-region, West Africa. We are short of specialists, and then being inducted today, I'm glad to add my quota in developing this sub-region, making sure our people at least have quality healthcare.
I just got inducted as a member of the community medicine department, and I've been practicing since 2015. And yeah, so community medicine, because it's important. If the COVID pandemic has not taught us anything at all, it's taught us to think beyond our consulting room and think about the community, because there are a lot of communicable diseases coming up, and having an idea of what you have to do and how to protect the whole community is important. And you know what other people are doing in their countries, you get to study together. We did some group, discussions with people from other countries. Then you know that our health system is not too different. You know what they are doing to strengthen theirs, and you can borrow some of these, approaches they are using in your work as well. And this is very important to me as a public health person, because you cannot know it all. So getting knowledge from your neighboring countries that have similar socio-economic dynamics as yours also helps,
For more news, please visit our website graphic.com.gh, or follow us on Facebook at Daily Graphic and on YouTube and Twitter at GraphicGH.
Subscribe now.